Okay, we'll go to the next talk by Dr. KAROBI LAHIRI. Can I introduce you? Dr. KAROBI is a veterinary surgeon from Mumbai. She is a very, very senior ophthalmologist practicing retinopathy of prematurity for many, many, many years. And she has again experience in both the basic care of ROP as well as all the way up to the performance of surgery for complex retinal detachments. Dr. KAROBI, for you.
Thank you very much, sir, for the kind introduction. And good evening to all of you. The topic that I'm going to deal with today is the risk factors for ROP with potential mitigation. Now, as we all know that ROP is a two-phase process where the first phase is that of hyperoxia and the decrease in angiogenic factors which causes vasoobliteration, followed by the second phase of hypoxia, which is an increase in angiogenic factors and secondary vasoproliferation. The risk factors which are there revolve around these factors primarily. Now, prevention is better than cure. So a proper prenatal counseling is very important because a preterm birth, I think it causes a little bit of echo. Is it giving an echo?
It's okay.
It's okay. Okay, a preterm birth is due to a in utero exposure to infection and inflammation. So idea is that if you are preventive in getting a preterm baby born, you have sort of won a big battle. So now the current interventions are involving the obstetricians, the pediatricians, the midwifery nurses, the neonatologists, the nurses in the NICU, and the ophthalmologists towards preventing premature labor and delivery. The administration of antenatal steroids is supposed to be helpful and to decrease any perinatal inflammatory conditions. Now, when we come to the maternal and environmental risk factors, reducing these also could prevent the problem of premature deliveries like smoking, drinking, drugs in the mother. The mother should not be less than 17 or greater than 35. Stress, low socioeconomic status, abuse, overworking, these are also stress factors, and exposure to air pollution, lead and radiation, and chemicals like paint, plastic, and smoke, these are factors to be avoided to try to get a normal delivery which is at term. Now, the remedy is that you advise to the contrary, that is, the gynacs have to spend potential time with the parents and create an awareness of what can be if they don't adhere to these norms. So it requires a little time spending. Now, once the child is on its way, the important things which cause the prevention of ROP, or the acceleration of ROP, is low gestational birth weight, gestational age, low birth weight, anemia and blood transfusion play a major role, and administration of oxygen more than 7 days in a particular concentration. The other factors are those of the apnea and bag and mask ventilation, the respiratory distress syndrome leading to IVH, and surfactant therapy. So as we know, there is a risk factor score. That is, you find that the lower gestational age, lower birth weights are more prone to developing ROP, as we all know. But there are a lot of associated risk factors which also can be dealt with. That is, if you have patients of IVF pregnancies, be very careful because normally it always lands up with multiple births. Very few are single birth babies. And these are children who are prone to have cerebral palsy. Now, in the delivery room, there are certain risks which put the child at risk. And these are also supposed to be known. That is, a difficulty in transition, cold stress, and the lung immaturity, which causes an RDS and later intraventricular hemorrhages. These are statuses which you could avoid by use of warmer blankets. The AC should be off in the NICU, and swathe the baby nicely in proper clothes and sometimes even sweaters, and keep them in the baby crib. Now, the newer risk factors, there are certain systemic risk factors which are there, which is of the patient could be asphyxiated, it could be hypoxic, convulsions and shock, acidosis, alkalosis, hyper and hypocarbia, hyperglycemia, even hypoglycemia, jaundice and sepsis. These are all risk factors which predispose to the development of ROP. And certain other factors are blood transfusions, parenteral nutritions, which is important, which is not given many a times, early intubations, hypotension, administration of beta blockers to the mother, and candida sepsis. These are other new risk factors which predispose. So if you see a child who is born of ROP can have problems in the lung, that is, the child can have a bronchopulmonary dysplasia or an asthma, and these asthma-like symptoms persist throughout the life. In the intestine, they could have a necrotizing enterocolitis. Infections like pneumonia and meningitis are common. Vision problems of ROP, hearing losses can be there, and dental problems are there. So, on certain analysis which was done, the gestational age, younger and lighter birth weight, postnatal hypotension, inotropes use, bronchopulmonary dysplasia, intraventricular hemorrhages were common independent risk factors for development of ROP, and especially the type 1. And on a multivariate analysis, it was found all these other factors, along with thrombocytopenia, intraventricular hemorrhages, total parenteral nutrition, and hypoglycemia, were significant risk factors for ROP. Now, the RDS is an incidence which can occur in all premature infants. The lower the gestational age to 37 weeks, especially diabetic mothers, multiple gestations, and surfactant deficiencies are prone to this, which is evidenced by nasal flaring, cyanosis, and tachypnea. The intraventricular hemorrhages are due to oxygen delivery fluctuations and oxidative stress, which promote hypoxic, ischemic, and reperfusion injuries, which cause ROP development. And 50% of these children can die. And they generally affect children less than 28 weeks of gestation. The apnea of prematurity affects about 50% of the NICU infants. Again, the symptoms, the signs are those of cyanosis, bradycardia, pallor, and hypotonia. And there is cessation of respiration for 10 seconds or 15 seconds. So you know this is an apnea. And if you have it during procedures, you can just tap the foot of the baby. The baby starts crying then. The neonatal factors, other factors, newer risk factors are inhaled nitric oxide, erythropoietin delivery, dopamine treatment, caffeine treatment, and thrombocytopenia. Now, can prematurity affect the brain? Yes, it can. It can lead to long-term intellectual and developmental disabilities. And the disabilities run to the form of physical development, learning, communicating with others, getting along with others, taking care of himself, and also behavioral issues like ADHD, ADD, anxiety neurological disorders, cerebral palsy, and autism spectrum disorders. So, certain pituitary, I already mentioned to you about the multiple births, and infants who are born with CP have an incidence of vascular anomalies. And also, there is an association between genetic issues and Norris disease, FER, and ROP. Erythropoietin, again, is used to reduce the need for red blood cell transfusions in preterm, and that is also a prominent risk factor. Favorable factors have been told to be that of preeclampsia, administration of antenatal steroids, administration of vitamin E is doubtful because there's no kind of study on that. They say administration of human milk is good because it increases the level of IGF-1, phototherapy. So one can say that human milk, it causes the level of IGF-1 increase, and that it causes it's crucial for physiological retinal vascularization, and its lack can lead to impaired retinal vascularity and ROP. So what are the remedies? The remedies to get less ROP is oxygen monitoring, infection control, look after the nutrition, the temperature control, supportive developmental care, and pain control. And there are certain pathologic and physiologic factors which regulate all the vital signs. There are heart rate, pulse oximetry, respiratory system, and blood pressure monitoring. These require constant monitoring right from the time that the child is born. So you can, in turn, change alert certain parameters of the physiologic determinants and the pathologic conditions which predispose to ROP. Now, what are the preventions of ROP, the do's and don'ts? Use a pulse oximeter soon after birth. in whichever way, whether the child is in the NICU or being transferred or during the NICU stay. And what is important, maintain a target SpO2 of about 88 to 92%. Avoid large changes of the FiO2 during desaturation and decrease by 5% every time. Also, the FiO2 recommendations for resuscitation is 30 to 90% only. And it takes about 5 minutes for the SpO2 levels to get this just after birth. Avoid oxygen administration if the baby has good respiratory efforts. And if you're using any of the this, you can remove the reservoir so that a certain concentration of FiO2 will be there, that is 40%. And if you're using Neopuff, that is also a good oxygen air blender, which helps out. So lower and more tightly controlled saturation limits also reduces the severity of ROP and any adverse effects, especially those of BPD and neurological symptoms. Sepsis, again, strict aseptic precautions are always taken in the NICU. And also when there are IV fluids being prepared, you have to prepare it with a lot of caution and don't interrupt the IV infusion lines. Prevention of ROP, again, look after the nutrition of the baby. And TPN is for all the babies less than 31 and 1250 grams. Avoid hypotension. That is a mean BP as per norms of mentioned. And miscellaneous factors is that, again, the steroids, vitamin E, and light exposure. So the 5 common things that you will look after is supplemental oxygen exposure, hyperoxemia, hypoxemia, positive pressure ventilation, because you can go a long way in reducing all the effects that it causes. So until ROP can be prevented, by knowing the underlying etiology and a modification of risk factors, it goes a long way towards prevention of the disease at prenatal or early postnatal levels, thereby reducing the incidence of ROP. Thank you very much for your kind attention.